Hi, I'm Randy Phelps. My co-authors, Amanda Venskoyak and Melissa Marquardt, and I thank you for your interest in our paper, Parental Misattribution of Environmental Stress Reaction Symptoms to Autism. A few years ago, the three of us were working together in a developmental diagnostic clinic at Oregon Health and Science University. And we observed that although a high proportion of children were referred to the clinic for a question of autism, only a small fraction of these children ended up being diagnosed with autism. The rest were diagnosed with a wide variety of diagnoses, which reflects the broad differential diagnosis of autism spectrum disorder. This in itself is not particularly notable. In fact, this is exactly what we'd expect from having a robust community-wide autism screening and referral program in place. What was notable was the large number of children with a history of trauma or other adverse childhood events who are presenting for a question of autism and whose presentation didn't remotely fit autism, but fit very well with a trauma and stressor-related disorder diagnosis. Although we as diagnosticians would have clarity about the diagnosis, we often found it very challenging to convey this diagnostic information to families. And this made for very stressful feedback sessions. It seemed, at least anecdotally, that there was a low level of awareness of trauma and the impact of trauma on development and behavior among these families we were seeing, especially relative to the relatively high level of awareness of autism. And this was very challenging, and we needed to get it right because the diagnosis drives the interventions. And the interventions for autism and the interventions for trauma and stress-related disorder are quite distinct, and so we really needed to convey this information to drive appropriate interventions and help these kids get better. But it was hard to convey this information. For one thing, valuable services are attached to an autism label that are not attached to a trauma label. Also, the autism diagnosis doesn't imply anything about parenting the way that a trauma and stress-related disorder might imply something about caregiving. So we wondered if this diagnostic confusion was simply the result of referral bias in our particular clinic, or if it might reflect a wider phenomenon of greater interest. So to get at this question, we compared parental impression about autism versus trauma in the child development clinic where we were working. And we compared that to parents' impressions, diagnostic impressions, prior and after diagnostic assessment in an outreach clinic for a therapeutic preschool for kids at risk of trauma. And we also compared to a third clinic, a genetics clinic, where kids have established genetic syndromes but are presenting for question of a comorbid development or behavior diagnosis. And what we found is across clinics, parents demonstrated greater concern about autism than they did about environmental stress. And also the children had a higher rate of symptoms attributable to environmental stress than the referrals would otherwise anticipate. We did run surveys of children not referred from the therapeutic preschool to get at the question of referral bias, and we did find that referral bias played a role. But in summary, we did find that there did seem to be an overall tendency for parents seeking consultation for an autism diagnostic assessment to attribute their children's behavior problems to autism at much higher rates than to environmental stress. From the 1940s through the 1990s, there was a very low level of awareness of autism spectrum disorder. And this really adversely impacted children with autism, because this low level of awareness prevented these children from receiving much needed services and support. As a result, opportunities for intervention were tragically missed for these children. With the increase in autism awareness over the past generation, these children are now being diagnosed, and they're being referred for helpful services and supports. Currently, however, as we document in this paper, there are low levels of awareness of trauma and stressor-related disorders, and this is hampering the process of obtaining appropriate intervention for kids who have experienced trauma. Additionally, although there's a great need for quality trauma-informed therapy and other services, these services are greatly lacking due to a lack of awareness about this issue. With this paper, We hope to raise awareness of trauma and stress-related disorders, with a goal of encouraging consistent screening for trauma and stress-related disorders in developmental diagnostic clinics. And we also hope to prompt advocacy for the creation of greater quality and capacity of trauma-informed therapy and other appropriate services for children in our communities who have experienced adverse childhood events. Thanks again for your interest.